Hi, everyone. It's Dr. Jen Freiheit here. I hope you can hear me. And I am Skyping with Sean Smith. Thank you, Sean, for setting this all up. So let me know if this is not working. But I just thought I would start answering some of the questions that I have received so far. And then I can continue answering as you have questions that come up. But I think I'm going to be able to answer a lot for you tonight. So thank you all for having me. I wish I could be in person with you all, but I appreciate that we're doing this remotely so that we can all stay distanced. So that's the name of the game, right? So just a little bit of background. I have participated in many different public health emergencies. And for example, I started my Wisconsin public health career with the anthrax scare of 2002 and 2003. I was part of the monkeypox response, the first time that was ever seen in the Western Hemisphere in 2003. I was part of the pertussis response. In 2004 and 5, there was a huge outbreak of pertussis, mumps of 2006, measles of 2008, H1N1 in 2009 as I was regional coordinator. I was also part of the Patrick Cudahy fire response in 2009, the South Milwaukee water main break in 2010, and Legionella in 2010. My list goes on, but I'm not saying this to toot my own horn, but to just compare that this COVID response is the one that sort of has my heart sinking. With all that other public health emergency response experience, this is the big one. And I keep telling my employees that this is the Super Bowl of our life. This is the Super Bowl of our public health career. This is why we all got into public health, to be able to do good and make a difference, and this is the big one. So we all have to take it serious, and that doesn't mean be panicked or be in crisis mode, or, we're trying very hard not to increase people's anxiety, which I know is going through the roof. But I have really been looking at this response as being proactive instead of reactive. So, we implemented a number of measures before we ever even had a positive case. That was in an effort to be very proactive. We were on this cusp of deciding, do we be proactive, which has a bigger economic cost, or do we be reactive, which could potentially have a greater loss of life cost? So we were right on that cusp last Thursday of, do we be reactive or do we be proactive? And clearly Kenosha County is a leader, and we chose to go proactively. And this isn't to be doomsday scenario, or be a doomsday theorist. I'm really hoping we can squelch some of those rumors together, but this is just to be prepared and to be more preparedness theorists. And so my mission is to really see that the Kenosha County Division of Health and Kenosha County in general are leaders, and that we're proactive and we're mobilizing all the resources and the right people and the right resources that we need to be able to mitigate this as best as possible. So that's just a little bit up front. Our Division of Health staff is amazing. I was doing a WLIP live chat today, and they sort of asked, how is your staff doing? And I thought, they're doing amazing. We're stressed out. I mean, we are at critical max right now. The workload is astronomical. We're working 12 to 14-hour days. It's pretty nuts, but this is what we've trained for. This is what we do. Since 9/11, we have emergency response plans. We've enacted all of that, the COOP-COG plans. I mean, we're doing it, and they're amazing, and they're handling it. It's also been very helpful with the schools closed, because now we have 9 school nurses back in-house that have been able to greatly enhance our workforce and allow us to increase capacity. So that's been amazing, and everybody's spirits are up. We've gone through a lot of chocolate. So that's how we're handling it within the Division of Health, and we're trying to be as communicative as possible with answering Facebook posts and press releases as often as possible, twice a week, situational reports, all sorts of different communication things to keep getting out the messages as fast as we can. And unfortunately, as you know, it's changing, not day by day, not even hour by hour. It's changing minute by minute. So it's extremely hard to keep up with. We try to get an update out, and an hour later it's completely obsolete. So that's sort of the situation we're dealing with here. But let me delve into some of the questions I have first, and then I'm sure there'll be more coming through the Skype feed here. So I did have one question. I'll just read the question and then I'll answer. I would like to know what emergency management is doing. Have they held any meetings? So in the EOC today, Horace had the first meeting as far as all of the partners through the emergency management realm. It was a face-to-face meeting, and we will have no more of that. So all future meetings will be virtual meetings. The next question is, what are their plans? So Horace has established the Web EOC, which is a platform where we can talk, share best practices, come to conclusion, come to agreement on things. And we really went through today talking about what is everybody doing in all the municipalities and what are all the various fire, EMS, police, what measures are they taking, what are they doing, so we could get a really good situational brief from everybody. And then we also sort of spoke about, well, what is the threshold for the next big thing? You know, if America goes on national lockdown, much like Italy, Spain, you know, China, what would that look like for Kenosha County? What would we need to do? What decisions would need to come next? And so that will largely be the topic of the next meeting of how will we coordinate if we need to go to that level and really activate the EOC in a larger sense. The next question is, can we get a briefing from the director of KCEM? And I obviously think Horace is available whenever. So, you know, he would be delighted, I'm sure, to give whatever briefing he can give. How do we get our kids and friends to take social distancing seriously? Yeah, this is a great question. And my, you know, glib answer is we all have to model the behavior, right? If we're all modeling all the good behaviors, not getting anxious, making sure we're washing our hand, not just being flip about it or going to the grocery store or whatnot, that if we're modeling the behavior, that definitely helps. I know I have 3 kids. They're ages 4, 6, and 9. And, you know, we do a lot of talk very seriously, as my 9-year-old is super interested in science, about, you know, flattening the curve and the science behind this. And I know that that makes everybody a roadside scientist, but there is, you know, some things to kind of bring it into perspective for those. I find that among my children's friends, they're taking it more seriously than most of the adults in the neighborhood. So, so it's really modeling the behavior and really having those conversations to let people know what public health is doing, what it means, you know, and I'll get into some of those more details later to sort of empower you with the things that you could be telling people that you're talking to in your circles. This next question I love. The question is, are there any social media initiatives aimed towards teens and young people to get this point across? So I love this because this is where the fun sort of happens deeper into emergencies. So looking back at the H1N1 response, you know, the first month was kind of chaos, but by month 3 of the H1N1 response, which went, you know, almost 10 months, by month 3, we had these national agencies that did these video contests and social media things and, you know, how to wash your hands and do all of this sort of stuff. And once the onslaught of this early COVID response settles down, I bet we will see a lot of national agencies like the American Public Health Association or the National Association of City and County Health Officials called NACHO. I bet we'll see more of this kind of campaign to really help ride the storm for our teens and young people through social media. One thing that we're doing in the Kenosha County Division of Health is, as soon as things sort of settle a little bit in this next couple of weeks, we will be implementing a sort of hand wash video campaign on our Facebook page. So more to come on that, but that right now, that isn't the most urgent priority. So we're looking for suggestions there as well too. The next question is, how many have been tested in Kenosha County so far? So the answer is 50. We've had 4 positives. And so if you didn't see today, we had the 1 positive and then we had 3 more as of today. We've had 21 negative confirmations and there's 25 still pending. So 50 has been the total number of tests from Kenosha County. Is there a connection between those who have been tested positive? The first case, the 59-year-old female that we put out the press release on, she had no connection to any of these other 3 positives we've now had. She had no travel history and she had no close contact with anybody that was COVID positive. And I'll get into these other 3 in a minute, but that means, yes, it is being spread amongst the community. We now have community spread from our very first positive. And that's the dangerous situation we thought we would try to avoid. And here we got it from our very first case. And then the other 3 sorry, my computer just shut down and I'm turning it back on. Our other 3 were all in the same family. So that is why on this recent press release, we didn't put out the information about ages and things of that nature because it was too identifying for this family. And so we didn't go that way. We left it as, you know, the protected health information. And those 3 are connected by having both travel and a close contact to a COVID positive case. And that is the 4 at this time. The next question is, Kenosha County well-stocked with tests? No, is the definite answer there. Kenosha County Division of Health, we have no tests. Currently, the providers, meaning doctors, have them. I wouldn't make a blanket statement that they all do because I'm not sure, and we're having difficulty getting numbers from who has what. The hospitals definitely have them, but we're very limited in being able to test. And I'm going to go into a little bit more about the new guidelines that just came hot off the press this afternoon about testing, but let me just answer the next quick questions and then I'll go into that testing. So we are not well stocked with tests, and neither is the rest of the country. I mean, we're all hurting, hence these new guidelines that came out to put some semblance of order to every worried well and every person wanting a test. The next question is the test a blood test, swab, or something else? So you keep hearing on the media that it's called a test kit. Really, it's just a nasal swab. If any of you have ever gone to the doctor to be tested for influenza A or B, it's like a very large Q-tip that gets stuck up your nose, and then it goes into a tube with some reagent. It's called a medium, and that gets shipped off to the lab in that medium. So there are no blood tests or any other tests for it at this time. It's just this nasal swab. Where the test being processed, in parentheses, it said within the county or sent out, and what is the turnaround time for results? So there is no testing within the county. They're all being sent out at this time. There are 4 locations at this time that can test for us. One is the State Lab of Hygiene, and their turnaround time is 24 to 48 hours. There is the City of Milwaukee Health Department Lab, and their turnaround time is 24 to 48 hours. However, both of those labs are at critical mass capacity right now, even though they have greatly beefed up their staff and ability to do this. Then there are 2 private labs, Quest and LabCorp, that are also able to test. However, their test results can take anywhere from 4 to 7 days to get back. So there's pros and cons to both. Obviously, it takes way longer to get a private lab results back. It doesn't always get sent through our state health department, which is sort of a problem. For example, when the state lab or the Milwaukee Health Department lab gets a positive, and if it's a Kenosha County resident, I get a call immediately, even if it's 3 in the morning. With these private labs, they have tended to call back the infection control person at the hospital who may or may not be on staff. And so we're sort of finding out about it a little more in a wonky way, and we're trying to work that out as well now. I'm going to take this point just to pause on the questions because I wanted to read to you the latest guidance about testing. I think this is important as your constituents ask you what's going on, because the testing is the biggest question. So the State Health Department just put out some guidance today in a memo BCD 2020-09, and it came late this afternoon. So they were talking about how the testing that's come in has far exceeded their daily capacity. That both the state lab and the Milwaukee Health Department lab are identifying laboratories in the state and the rest of the country to send the lower priority specimens to for testing. The lower priority specimens will have a longer time to result, but that will allow our state lab and Milwaukee Health Department lab to focus on the higher priority tests. And I'll define what higher priority means in just a second. The State Lab of Hygiene can test up to 14 specimens per day. I'm sorry, 400 specimens per day. And like I said, that's a 1 to 2 day after receipt of it that they can get results back. The City of Milwaukee Health Department lab can test only up to 150 specimens per day because they're significantly smaller, and still a 1 to 2 day turnaround time. Just some other quick facts. Today alone, the State Lab of Hygiene received more than 1,000 tests, and yesterday they received 800 samples. I shouldn't say tests, sorry. 1,000 samples today, 800 samples yesterday. So that's 1,800 sitting in queue, and I had just said that they can only get to 400 a day. So they're ramping up their capacity. but it's also a matter of them having the right reagents and things at their disposal, the resources that are also very tight around the country. So because of this and not being able to keep up with demand, they have implemented a tiered system so that we can determine for those whom a timely diagnosis is most urgent. So, you know, that basically means those that are hospitalized. Those are the most urgent people. If you're already hospitalized with a respiratory something or other, you're in this tier 1. So the message is that healthcare providers should begin identifying alternate laboratories as well for testing those lower priority specimens, which I know many of them are. Obviously, from the current positives we have, they are using other providers as well. The big thing is, the message we are going to get across is that if you are not symptomatic, if you are not having a fever, no cough, no whatever, shortness of breath, whatnot, there will not be testing for the asymptomatic. There will not be testing for those with mild upper respiratory symptoms. There just aren't enough tests to handle people who are showing no symptoms and are showing mild symptoms. What we're recommending for those people, let's say if somebody has no symptoms, but they swear they came in contact with a positive, we're recommending that they self-isolate at home, keep taking their temperature, keep monitoring their symptoms to see, you know, when fever might end up starting and recording that. And then obviously being able to call their doctor should their symptoms start to arise. So just so you know, the tier system, tier 1 and 2 is all that the State Lab of Hygiene in the Milwaukee Health Department lab will be testing any further. So tier 1 is basically a patient who is critically ill and receiving ICU level care with, you know, viral pneumonia or respiratory failure, or if a patient is hospitalized in non-ICU settings, but they have a cough, shortness of breath, and one of the high-risk conditions such as being exposed to a positive COVID or travel to an area where there's sustained transmission. So that is tier 1. Tier 2 is hospitalized patients and long-term care residents. This is where the over 60 population, long-term care residents, and those people who have an unexplained fever or signs and symptoms, or healthcare workers fall into this tier 2 with unexplained fever and signs and symptoms. So that is tier 2. Tiers 1 and 2, those are the only people that our 2 labs in the state will continue testing until further notice. Tier 3 is basically for the people who are in an outpatient setting and they might meet the criteria for influenza testing. So they might have some of the symptoms of fever, you know, sore throat, shortness of breath, and they might have other comorbid conditions such as diabetes, congestive heart failure, COPD, but they're under the age of 50. Or tier 3 is also healthcare workers with just mild upper respiratory symptoms. So we have to take care of those healthcare workers and get them back in line as soon as possible. So we have priority prophylaxis lists within the health department so that we can take care of EMTs, paramedics, healthcare workers, all of those who we need to rapidly get a test on and get them back out in the field to know whether or not they're positive for COVID. Tier 4 is all the other patients that a public health department or an infection control authority might deem necessary. So let's say we're investigating somebody for a positive COVID, and there's a pretty high probability that their spouse or somebody, even though they're not showing any symptoms, could have COVID because they've been in such a close contact. We can then make that recommendation for tier 4, but that means we would have to find an outside lab to test them. So we will not be testing patients without symptoms. When I say we, not just the health department, we meaning now every doctor and hospital in the state. And we will not be testing patients with mild upper respiratory symptoms, only those who are healthcare workers, first responders. So that is just I wanted to go through the details about the new testing guidelines because they're very new, and it's very important that we get that messaging out so that people there's doctor's offices are getting inundated, people are showing up at the emergency department who have no symptoms, and the message is you're just not going to get a test. All right, moving on down the list of questions. How will residents be informed if they potentially had contact with any residents that tested positive? Great question. So when a test comes back positive, our health department gets contacted, and by state statute, we have to begin investigation immediately. So not unlike a police detective, we are like disease detectives. So we begin calling them, finding out when was your onset of symptoms, when was your fever, who lives in your house, where do you all work, what church do you go to, what grocery stores have you been to. We have, it literally takes about 90 minutes per person to investigate and find out all the information. Sometimes they have to give us a call back and say, my child was at this sports, basketball team or this dance thing or something, and they have to give us all the names of the people and the phone numbers of the close contacts they were in touch with. So we literally go through all of this. We collect all the information. What time were you at that store? How long were you at that store? How many people were in that Bible study with you? So we're doing all of this investigation, and that leads us to their close contacts. We then have to follow up with every close contact. So if let's say it's a child in a school, we ask that school, okay, let's say it's a second grader. We would say, are the second graders pretty well isolated to their own classroom, the 30 kids plus the teacher, or do they mingle all about the school? And that would determine if that classroom is just a close contact or potentially everybody in that school is a close contact. So we have to follow up with any close contact then until we sort of go down the chain of epidemiology and hit the point where there are no more close contacts. So a public health nurse would call, and that's how a potential resident who had contact would be contacted. If you get no contacts from a public health nurse, that means you haven't been in contact with anybody who's a positive case. The next question is, what is the assumed or projected effect, numbers-wise, for Kenosha County? And this is the million-dollar question. There's so many factors that feed into this, and we're looking greatly at Wuhan. China right now is reopening and people are starting to mingle about again, and the rest of the world is watching with bated breath because are they going to get reinfected? Are they at a point where they can open up borders and open up to people leaving their homes, or will they see a second surge? We don't know. This is a novel virus. We don't know enough about it. The scientists are working around the clock to try to give us as much data as they can so that we can project these kinds of numbers. So, there's so many factors too, because Kenosha County went with our assisted living facilities and long-term care facilities, we recommended essentially going on lockdown, restricting visitors early on. That may have helped to decrease the number of sick and death that we will receive later. So it's hard to prove a negative. And that's the million-dollar question. We may not ever know how this is projected, but we will keep trying to map it and look at it and see where the targeted communities are, but it's already community spread. So that's where we sort of are with that. Who and where is currently testing for COVID-19? So at this very moment, it's providers, which are like doctors or clinics, and hospitals. Those are the people who are able to test, but as I just read those testing guidelines, now even doctors and hospitals are on much tighter restrictions as to who they can test. If any, who and why haven't other healthcare facilities begun testing? We're hearing a lot of conflicting data out there. We've had many tearful residents on our phones that have said, my daughter's sick, she has fever, she was at an international sports thing or something, and my doctor turned me away, they wouldn't test me. And we're hearing, as we tried to sort of investigate this, some physicians are saying they don't have this nasal swab and the reagent. Some are saying, some are using the CDC screening and they're screening people out that they don't feel meets the CDC screening guidelines. We have some providers that are immediately testing for influenza A, B, and COVID. So that's 3 nasal swabs at one time. The CDC has initially left it up to provider discretion. That means a doctor can choose what they can or cannot do or what they can handle capacity-wise or who they're going to test using CDC guidelines, or they can use more stringent guidelines if they so choose. So that is why we're hearing some providers have begun testing and others have not, and it's been across the board and everywhere across the country, but also in Kenosha County, it's been varying greatly. The POTUS has suggested that this may last until July or August. Do you concur with that assessment? I had heard that today, and it was really unclear whether the president was talking about July or August being the peak or July or August being the end of this. And as many of you have probably seen, there's that whole social media campaign about flatten the curve, which is kind of cool. People are learning about science and learning about public health theory and how things work. It all depends so let's say in Kenosha County, if we practice these social distancing measures, we all go on lockdown, we all stay home, we avoid public gatherings, that is the way to flatten the curve so that we're not putting undue strain on our healthcare system. Does that mean that we'll be done by July or August if we do that flatten the curve model? Probably not. That means you prolong the duration of a virus. You just ensure that there's less death, less sickness, and we don't overwhelm our healthcare system. If on that flatten the curve model, if you see the big spike, could there be potential we're done by July or August? Maybe. We're kind of working in public health on the long curve because, H1N1, which wasn't even this severe, took 10 months until we really started pulling out of it. So we're in this for the long haul. That July or August, I don't know if he was meaning the peak or the end, but that's, that might be generous. It might be spot on. We just don't know. How much longer do you suspect that we may be under this level? Yeah, and this is the heartbreaking one that I know some people around the state are closing for just 2 weeks. Some are closing for 4. Some are closing for 6 weeks. I definitely think it's going to go longer. Does that mean we need to be in a closure state? I don't know. We'll be monitoring it and looking at the international numbers, looking at how Italy and Spain are decreasing. I mean, there was just 362 deaths in Italy on Sunday alone. So even though Italy's been on lockdown for over a month, I mean, they're still in the height of it. They haven't even reached peak yet. So, and they've been on severe lockdown. So based upon what's happening in other countries and what's happening in Seattle, this could potentially go on much, much longer. And I know that affects everything from high school proms to graduations. And I just don't know how this is going to turn out because it is so novel. That is the end of the questions I had previously sent to me. And I'm looking at Sean's Skype to see if anybody else has emailed any questions. If there's anything else I can answer for you. But that is the latest and greatest that I have. And I see that it says no more questions. So, so I just wanted to, you can email me or call me at any time. Some of you have. Thank you. I appreciate that. I may not be as fast getting back to you because I'm now 5,000 deep in my unread emails. But I want to make sure that I'm attentive to your needs and your calls and what your constituents are seeing and that we're answering your questions. I want to empower you so that you have what's going on, the truth of public health and what's happening so that you can give the right answers and help to end the rumors, help to end speculation, put certain things to bed and really let people know that, I know there's a lot of anxiety, but that's where, public health has a toolbox, and we started out with our simple things, right? Like wash your hands and cough into your sleeve. And then we had to move to more drastic tools in the toolbox where, it was like no visitors to long-term care facilities because this virus seems to be affecting the over 60 and the immunocompromised. And, then we had to get out a hammer and, no restaurants and bars. And so, we're constantly just pulling out whatever tools warrant, and that's changing minute by minute. And, so then you might think of the sledgehammer as complete lockdown. Nobody's allowed to leave their house. And, like Italy, there's a $230 euro fine if you're caught walking on the street. So, so there's still more tools to be had, but we're trying to employ whatever we can, and we need your help to really get those messages out and to model the behavior for the rest of the county. So everybody's been very supportive. Everybody's been amazing at understanding the public health needs, jumping on this, being proactive. I've heard of several businesses or several agencies who are maybe not taking it as seriously or allowing people who have traveled to come back to work or allowing sick people to come to work. And we definitely do not want anybody coming to work with any sickness, even if their symptoms are mild. My constant message is, even if your symptoms are mild, do not go to work because we just don't know enough about this right now. You know, you could be a healthy person who has COVID, your symptoms are mild, and you get over it a couple of days later. But then if you've been a vector out in the community spreading it, well, then you're not helping the healthcare system, and you're not helping all of those out there who are immunocompromised, who this could be deadly for. So I'm pausing just a little bit because to see if there are any more questions, but it seems like there aren't any more. But reach out to me, let me know if you need anything, and we'll keep working hard and making sure we try to contain this as much as possible.
Dr. Freiheit?
Yes.
We did get a last-minute question here.
Yeah.
In the Kenosha News, it was stated, we're using the lab at Freiheit and the Medical College of Wisconsin rather than going to the state or CDC labs. Will these privately done test results be shared with the county?
Yes, by state law, any test results have to be shared with us because we statutorily have to follow up with it immediately. So I did not know they were going there. So whoever the hospitals have made their arrangements with, that's great. I mean, you know, everybody's trying to find their source to get things done rapidly. So. All right.
Anything else has come in at this time?
All right. Well, thank you all so much. We'll keep working hard for you, and let me know what you need. And hopefully we won't see each other real soon, but we can keep talking over these conferences if necessary. Thank you.